Hey, it's Scott. And I'm here again with Angie Bowen at the Region 2 EMS Directors Association Conference in Gatlinburg, Tennessee. And in the past couple years, after playing flight for many, many years, some of y'all remember that now both Lisa and I have a truly unique job that we're working as paramedics at Universal Studios down in Orlando. And as part of that, at Universal, they have a couple unbelievably well done escape rooms. And as you can imagine, if you have 80 gazillion dollars and lots of Imagineers a la Disney, you can create an amazing escape room. However, what we want to go ahead and touch on now is a far more cost effective and, more importantly, very much pediatric focused escape room idea as well. Angie, if you would.
So, as you said, Scott, there are these great escape rooms out there, and they seem so unattainable with the budgets that we have. But we said, how can we make an escape room on the cheap? Now, it's not going to be hours long and elaborate, but something you can do with your providers within a short period of time and amp up the competition a little bit. We have found a great deal of interest in these things because, as you know, emergency providers are quite competitive, so they all want to beat each other's time.
That is an understatement at best.
So we said, how do we do this with what we have? So I started with, as you can see, ours is in this hanging file folders box, empty. That should give you a little idea of how low tech this is. But you could do this in whatever setting you're in. You can use a roll truck, but we started with a strap and a lock, and we put it on the back door of the ambulance. There are days where you feel like you are truly locked in the ambulance all day or locked in the ED all day. And we said, your ultimate goal is to find the code to that lock in order to get out of the ambulance. So, of course, it was timed, and we kept a scoreboard to see who was the fastest, and we gave them very small little gift certificates to a local convenience store to get a beverage and a snack. But we started with some clues, and some of these are not very sophisticated, but clue number one, and we had a lot of fun writing these, is to finish in time, the minimum systolic blood pressure you must find the patient is for, which folder will you score? And so we have different systolic blood pressures written on here, and when they find the right one, the next clue is inside. So I certainly won't read through all of these, but different things, they had to choose the right size ET tube. And we have tiny little rolled up pieces of paper in here with the next clue when they find the right size ET tube for the patient that they're given. We have drug dosage calculations. We have lidocaine and amiodarone for this particular one, but they have to not only identify which medication they would use and what milligram dosage, but they also, the syringes are marked with milliliter, so they have to convert that milligram to milliliter, because we know that's where a lot of people make their mistakes, is going from dosage to volume.
Absolutely.
So that was one of the clues. We let them use the tools that they have. We have PD sleeves, we have PD tapes, but link-based resuscitation tapes, use those in part of our clues. And one of the other things we did is we made a very simple crossword puzzle. And if you go online and look at Crossword Puzzle Creator, you can create all of these. So we added pediatric clues, and it allowed them to spell out their next clue at the bottom. So that is really it in a nutshell. This one has 5 questions that they have to go through. We let them work as teams, and we tried to pair up different levels of licensure so that they could all capitalize on their strengths.
Smart.
Yep.
So it's not just ALS, you're pairing up your ALS, your BLS, whoever it might be, crew, which is life.
Yes, absolutely. And we, like I said, we used the back of an ambulance, and we hid things. So once they got a clue, they had to figure out that something was under the bench seat, for instance, or behind the drug box. So it also made them look at where things are in their ambulance and put their hands on the pediatric equipment, so that in real life, they're a little more accustomed to doing that. And I did not understand, I think, how much stress this would add, but because they were so competitive, it gave them that little dose of adrenaline that they would have in a real pediatric call, perhaps, to make them function under those circumstances.
I'm hooked.
Great.
So, as always, Miss Angie, thanks so much.
Thank you, Scott.